Hey everyone, welcome back to the channel. Today, we're going to talk about something that's both fascinating and a little bit eerie. We're diving into the story of a hospital that once stood as a beacon of hope and healing, but now exists only in memories and photographs. This is the story of a place that saved countless lives, witnessed incredible moments of human resilience, and then simply vanished from the landscape. So if you're ready to explore this forgotten piece of history, let's get started. Before we jump into the main story, I want you to think about the hospitals in your area. These massive buildings that stand day and night, where life begins and sometimes ends, where miracles happen, and where heartbreak unfolds. Now imagine one of those buildings just gone. Not renovated, not repurposed, but completely erased. That's exactly what happened to the hospital we're talking about today. And the story behind its disappearance is something you won't believe. The hospital I'm referring to was built in the early 1900s during a time when medical science was rapidly evolving and communities were growing faster than ever before. It started as a modest facility with just 50 beds, serving a small town that was beginning to boom thanks to nearby industrial development. The founders had a vision of creating not just a place for treating illness, but a true community health center where everyone, regardless of their financial situation, could receive quality care. In its early years, the hospital became known for its progressive approach to medicine. They were among the first in the region to adopt new surgical techniques, to implement strict sanitation protocols, and to train nurses in modern methods of patient care. The building itself was an architectural marvel for its time, with large windows designed to let in natural light, wide corridors for easy movement of beds and equipment, and an innovative ventilation system that helped prevent the spread of disease. As decades passed, the hospital grew along with the community. Wings were added, new departments were established, and the medical staff expanded from a handful of doctors to dozens of specialists. By the 1950s, it had become one of the most respected medical facilities in the entire state. People would travel for hours to receive treatment there, and medical students competed for the chance to complete their residencies within its walls. The stories that came out of this hospital are truly remarkable. There was the night in 1942 when a massive train derailment brought dozens of injured passengers through the doors, and the staff worked for 36 hours straight to save every single life. There was the pioneering heart surgery performed in 1963 that made national headlines and put the hospital on the map as a center for cardiac care. There were countless babies born, families reunited, and lives saved through the dedication of the people who worked there. But what really made this hospital special wasn't just the medical achievements. It was the sense of community that permeated every floor and every department. Nurses knew patients by name and would often visit them at home after discharge to check on their recovery. Doctors would make house calls in the middle of the night without hesitation. The cafeteria staff knew everyone's favorite meals, and volunteers spent hours reading to patients or simply keeping them company. It was more than a hospital. It was a second home for many people in the community. Throughout the 1970s and 80s, however, things began to change. Healthcare was becoming more corporate, more centralized. Larger hospital systems were buying up smaller facilities and consolidating services. Insurance companies were dictating more and more of how healthcare was delivered. The small-town hospital, once the pride of the community, was struggling to keep up with the financial demands of modern medicine. The building itself was also showing its age. While it had been state-of-the-art in its time, it now needed extensive renovations to meet current building codes and medical standards. The heating system was outdated, the electrical infrastructure couldn't handle modern medical equipment, and the layout was inefficient compared to newer hospital designs. Estimates for renovations ran into the tens of millions of dollars, money that the hospital simply didn't have. There were attempts to save it, of course. Community fundraisers were organized. Local businesses pledged support. Former patients who had been treated there decades earlier sent donations. The staff worked for months without raises, hoping that their sacrifice would help keep the doors open. But in the end, the economics just didn't work out. The hospital was absorbed by a larger healthcare system, and the decision was made to consolidate all services at a newer facility 15 miles away. The announcement of the closure hit the community like a bombshell. For over 80 years, this hospital had been a constant presence, a reassuring beacon that help was always nearby. Now, residents would have to travel much further for emergency care. Expectant mothers would deliver their babies in an unfamiliar place, and the elderly who had spent their entire lives in this town would have to go elsewhere for treatment. The final day of operation was emotional beyond words. Staff members who had worked there for decades walked the halls one last time, remembering the patients they had cared for and the colleagues who had become like family. Patients who were well enough came back to say goodbye to the place where they had been healed. There were tears, embraces, and countless stories shared about the impact this building and the people in it had made on so many lives. And then it was over. The doors were locked, the equipment was moved to other facilities, and the building sat empty. For a while, there was talk of converting it into apartments or office space. Developers looked at the property, architects drew up plans, but nothing ever materialized. The building sat vacant for years, slowly deteriorating. Windows were broken by vandals, weather damage accumulated, and nature began to reclaim the grounds. Eventually, the decision was made to demolish the structure. It was deemed too expensive to renovate and too much of a liability to leave standing empty. Over the course of several weeks, crews systematically tore down the building that had stood for nearly a century. Each day, another section would fall, and with it, another piece of the community's history. Today, if you visit the site where the hospital once stood, you'll find an empty lot. There's a small plaque that marks the location and briefly describes the hospital's history, but that's all that remains. The land has been sold, and there are plans to build a shopping center on the site. Within a few years, there will be no physical trace that a hospital ever existed there at all. But the story doesn't end with a demolition. The impact of this hospital lives on in ways both tangible and intangible. There are thousands of people alive today who might not be if not for the care they received within those walls. There are medical professionals who trained there and went on to distinguished careers, taking with them the values of compassionate care they learned. There are families who have been coming to that location for generations, who still remember the kindness shown to them in their most vulnerable moments. Some former staff members have created an informal archive, collecting photographs, documents, and oral histories to preserve the memory of the hospital. They meet regularly to share stories and ensure that the legacy of the institution isn't forgotten. Several have even written books or created documentaries about their experiences, wanting to capture the essence of what made this place so special. There's also been an interesting development in recent years. As that larger hospital, 15 miles away, has become increasingly overcrowded and impersonal, community members have begun advocating for a new healthcare facility closer to town. They're using the memory of the old hospital as inspiration, pushing for a facility that would combine modern medical capabilities with the community-focused approach that characterized the institution that was lost. The story of this hospital raises important questions about healthcare, community, and progress. Yes, modern medicine requires sophisticated facilities and expensive equipment. Yes, there are economies of scale that make larger hospital systems more financially viable. But what is lost when we close these community institutions? What happens to the social fabric of a town when you remove a place that has been central to its identity for generations? It also makes us think about preservation and memory. We're good at preserving grand monuments and historically significant buildings. But what about places like this? Places that might not have architectural distinction or historical landmark status, but that nonetheless played crucial roles in countless lives. Who decides what's worth saving and what's worth remembering? As I researched this story, I was struck by how many similar tales there are across the country. Small hospitals, clinics, and medical centers that once anchored their communities but have closed due to economic pressures. Each one has its own unique story, its own collection of memories and legacies. Each closure represents not just the loss of a building, but the severing of connections that took generations to build. So what can we learn from the story of this hospital that doesn't exist anymore? Perhaps it's a reminder to appreciate the institutions and places that serve our communities while they're still here, to recognize the dedication of healthcare workers who choose to serve in smaller, community-based settings rather than chasing higher salaries in larger cities, to understand that progress sometimes comes with trade-offs, and that efficiency and consolidation, while often necessary, can exact a real cost on community cohesion. It's also a call to document and preserve the stories of these places before they're lost forever. If you have connections to a hospital or medical facility that has closed or is at risk of closing, consider recording the memories and experiences of those who worked there and were treated there. These stories are part of our collective history and deserve to be remembered. In the end, this hospital may not exist anymore as a physical structure, but its impact continues to ripple through time. Every person who was born there, healed there, or found comfort there carries a piece of its legacy with them. Every medical professional who trained there took lessons that they've passed on to others. And every community member who experienced the kind of personalized, compassionate care that characterized this institution knows what healthcare can and should be at its best. Thank you so much for watching today's video. This story really resonated with me.